All right. Okay. I think we can just get started. I'm sure people are still joining us. They can catch up later, and also we will record the session today. So hopefully they can also review the session later. Okay. So first of all, welcome everyone. Take your time off over the weekend joining us today to learn about this program. Master in Science program in Medical Physics. And today I will give an introduction of the program. And this is part of the PolyU Info Day activity. And my name is Jin Kai. I'm a professor and program leader of this MSc MP program from the Department of Health Technology and Informatics. From the Hong Kong Polytechnic University. All right, so with that, let's get started. All right, just want to give you a little bit more details about my background so that you understand my background, and also that leads to your understanding of the background of this program, which is a new program, as probably many of you know about. So I have my PhD in engineering physics from the University of Virginia in 2006. Okay, and after that, I have my residence training in medical physics. Okay, also from University of Virginia. And in 2010, after multiple board examinations, it's 3 different levels, I received the certificate in theoretical medical physics from the American Board of Radiology. Okay, and so I actually graduated from the residency program in 2009, and I started my career at Duke University Medical Center. Worked there for 8 years, and I came to Hong Kong in 2017. Okay, and now 3 years later, okay, we established the new program of medical physics at PolyU. Okay, so that gave you a rough idea about the history of myself, and also I'm going to briefly introduce the history of the program later. And so I have been involved in education, clinical practice, and research in the field of medical physics for more than 10 years. Okay. So PolyU, this program is now established. The PolyU, last year, I believe, ranked 75th in the world university ranking. Okay, in the QS. It's also the 6th in the top 50 under 50. That means less than 50 years of history. Okay, so it's a relatively young university. And in Asia rankings, it's 25th. So, it's a good university, all right? That's a simple message for you. The program is currently offered in the Department of Health Technology and Informatics. Okay, so what you see here is that we have bachelor degrees in medical laboratory science, bachelor degree in radiography. Okay, in top postgraduate studies, we have 3 areas now. Okay, so in the past we have only 2, which is MSc in medical laboratory science, MSc in medical imaging and radiation science, and this program, Master in Medical Physics, okay, was launched last year, okay, 2020 and 2021 academic year as a new program. So currently, okay, our first cohort of students are in their first year. Okay, and the people who are interested in the program and enjoying the session today, you will, if you are interested, you will be applying for basically the second cohort of this new program. And in addition to that, we have the research postgraduate studies, including Master of Philosophy and Doctor of Philosophy, PhD. Okay, it did not specifically say medical physics, but some of the fields are related to medical physics, cancer, and some other things. So we do also have PhD degree program as well for medical physics. But this session today, okay, is focused on the TOEFL postgraduate study MSc in medical physics. Because this is a new program, we launched last year in September. The program actually has since then received a lot of attention from the public, and the news has been out in different newspapers and magazines. All right, so just for your information, that the program has since then running very well. Okay, so for many of you, it may not be very clear to you what exactly is medical physics. Okay, so let me give a brief introduction of that. So medical physics is an interdisciplinary field in which the concepts and the methods of physics are applied to diagnosis and treatment of human disease. Okay, so I think there are a couple of keywords. First of all is interdisciplinary, and second of all is the diagnosis and treatment. Okay, and mostly relates to cancer, but not limited to cancer. So in terms of disciplines under medical physics, and you can see 76% okay, is radiation therapy. So this is the treatment of cancer. 15% on imaging physics, and the other field includes nuclear medicine, health physics, engineering, administration. So largely you can see medical physics focus on radiation therapy. Okay, and the second part is imaging physics. So using radiation therapy as an example, and let's take a look at what's the role of medical physicists in a clinical oncology department. So this is a very typical example from a local department of clinical oncology. Okay, so first of all, you will see the doctors, physicians, or call them clinical oncologists. So these are the people who make medical decisions on how to treat the patient, using what techniques. And these are the people with medical degrees, okay, MDs. And maybe you are also familiar with, let's go to the RT first. So these are the people who actually treat the patients, okay? They handle patient treatment issues. These are our radiation therapists, okay? Also, we have radiographers who perform imaging for diagnosis, of course. So the operating machine, they manage and treat patients. So this cohort of people usually have bachelor or master degrees. As you can see here, 70% bachelor, 30% master. And in the middle, okay, that is the medical physicist. And this is a group of people, mostly doing works related to technology, right? So they will be responsible for adapting new techniques and perform technical related tasks during daily clinical works, okay? So this is a group of people, usually they have at least a master degree. Okay? And many of them have PhD degree. So I think currently, in Hong Kong, the ratio is about 60% to 40%. So master degree is a minimum requirement for medical physicists. So if you look at the overall medical physics workforce around the world, okay, you can see a steady increasing in the past 40, 50 years. Okay? So the trend here tells you the increased number of members of American Association for Medical Physicists. Okay, and it also happened similarly in many other different places. So a brief introduction of the medical physics community in Hong Kong. So currently there are about 150 to 200 medical physicists in Hong Kong, mostly working in oncology centers in both public and private centers. And currently there's no, before last year, no dedicated postdoc program in medical physics. Okay, so PolyU actually established the first one in Hong Kong and the nearby regions. Okay. So in the past, most of the medical physicists in Hong Kong obtained postgraduate degrees in physics or engineering. So it's not, a dedicated medical physics program, but something related. Or they obtain the postgraduate degree in medical physics from overseas universities. So currently, so this is a pathway in Hong Kong if you would like to pursue a medical physics career, okay? So you start with a resident physicist, okay? So that's more like an on-job training. And after a few years, you become qualified physicist, and after board examinations, you can become certified physicist. But even before you become a resident physicist, you have to receive a degree, right? As we said earlier, at least a master degree. So that is what has been missing here, the medical physics graduate program, and that's what we can provide now with this PolyU medical physics program. And also look at the bigger picture in overall in mainland China, and the market in radiation oncology market has been increasing about 10% annually, okay, for the next probably 10 to 20 years. So there's a great chance of increasing markets as well as healthcare in this area. And there is a severe shortage of medical physicists in mainland China as well. Rough estimation of the need of additional qualified medical physicists is about 2,500 with the current equipment level. But however, considering the equipment will also be increased, and ideally, okay, the shortage can be 10,000. Considering the patient need. So the bottom here, just want to give you some examples. There's a survey has been done recently showing that the great need of physicists in mainland China. So, because of this background, since I came to PolyU 3 years ago, I have been working on establishing this new program. And this is the overall structure of our program. As you can see, the program is has been led by the Department of HTI, okay, with a close collaboration with Applied Physics. Okay, so AP here is Applied Physics. So two of these departments working together with some other departments, including biomedical engineering, applied mathematics, computer science, electrical engineering, and all together established this program. And we also maintain a very close relationship with hospitals, local, non-local hospitals, the healthcare, especially the radiation oncology industry, as well as medical physics society, in Hong Kong and overseas. Okay, so this is the overview of the program. As you can see, this is the official title. The medium of instruction, English. Stream code. Okay, so we do have full-time and part-time. That's the mode of study. Okay, part-time or full-time. The normal duration of the study. Okay, if you choose full-time, it's 1 year. But this is a normal duration. It doesn't has to be 1 year, but it could be 1 year. For part-time students, okay, it depends how much effort and time you want to put into this. On average, it's 2.5 years. But if you want to complete in 2 years, with enough effort and time put into this, it's very possible. If you want to just take your time and gradually study, no rush, that's also fine. Okay. The credits required for graduation from this program is 30. This is a self-financed program. As you can see, the tuition fee here is Hong Kong dollars of 4,900 per credit for local students. For non-local students, 5,400 per credit. Okay, Hong Kong dollars. So, this is something I think you will be interested in. The entrance requirements, right? So this only, of course, lists the very basic requirements. We require a bachelor's degree in physics, applied physics, engineering physics. So basically, physics related, or bachelor degrees in natural science, mathematics, engineering, radiography, health technology, and other related degrees. Okay. It also has English language requirements. So these are very basic requirements. Okay, and we, most likely gonna perform an interview on, if not all, but some of the applicants. Okay, and we would like to emphasize that we do like to attract students with real passion about medical physics, about using physics and engineering knowledge and skills to help patients. Okay, I think the passion is greatly important. Okay, commitment to this career path and this field. Okay, so that's what we are looking for during an interview process. Okay, and also something we're looking for in your application, like personal statement and some other things. So I encourage you when you apply for our program. Okay, we would definitely encourage you to think through this and make sure you are really interested in this program, not only about getting a degree, but you are really interested in learning medical physics and applying medical physics in your future career. Okay. So about the curriculum, as we mentioned earlier, the required credit hours is 30, and that includes one compulsory subject. Okay, 3 credits. That's a research method and biostatistics. So this subject is required for all postgraduate students in the department. Okay, for medical physics, there are 7 core subjects with a total of 18 credits required. Okay, and the way the curriculum is set up is in alignment with international standards. Okay, so that's why these courses are, pretty much the same as if you were to go to other programs for medical physics education. Okay, it's very much the same. So that included radiation physics, radiation protection, radiation safety, human anatomy and physiology, radiation therapy physics, medical imaging physics, biology for medical physicists, ethical issues in medicine research. Altogether, this required core subjects take 18 credits. Okay, so compulsory and core subjects altogether, you can see it's already 21 credits. And all of these are mandatory. Okay, these are mandatory. So that leaves only 9 credits left, okay, for elective. And we have a number of elective subjects that can be offered to you. Okay, so these are some examples like clinical practicum, dissertation, further studies on dosimetry or different imaging techniques. Okay, and we have a full list of the elective subjects can be provided to you later. Okay, so one thing I just wanted to mention here is the dissertation, as you can see here, is not a required subject, it's an elective. Okay, the dissertation itself requires 9 credits. So if you take a dissertation, then that's pretty much all you can take from the elective. So for students who are interested in pursuing further degree, like PhD after this, then a dissertation will be a good choice. Okay. So teaching staff, and overall, here shows you the structure of the teaching staff. And the key components, of course, is the MSc MP program staff who provide the teaching for the key subjects that we just mentioned. But we also have people from outside departments who contribute to the teaching, including other PolyU staff from different departments, including practicing medical physicists from, mostly from local, and also practicing oncologists or radiologists, because this is a clinical field. Okay, we do need to learn quite a bit of medical knowledge. Okay, and in engagement from oncologists or radiologists are very important. And also have overseas scholars provide, some teachings or seminars or research attachments like that. So as you can see, we have 7 core program staff, over 20 other PolyU staff, over 30 medical physicists. Okay, there are actually currently practice medical physics in Hong Kong mostly, and larger than 10 physicians. Those are the oncologists or radiologists, and over 20 overseas scholars. So these are the people who contribute to the teaching of this program. So the key teaching staff for this program I list here. As you can see, it's collaboration between our department, HTI, and AP department, Applied Physics. Okay, so 5 key persons are from HTI and 2 from AP. So these are the subject leaders for the 7 core courses that I just mentioned. Okay, so I will not go through the details here for now. And here, just want to give you an example of the professionals, like the medical physicists, oncologists who are involved in this teaching for this program. And as you can see, okay, all of the people, they already receive certification, either from local or from international or other places, with extraordinary experience and expertise in different areas of medical physics. Okay, and this is just an example of some world experts in radiation physics who contribute to the teaching of the program. So currently we are conducting a distinguished guest lecture series in medical physics, and we just started. So these are the first 3 scholars from world well-known institutions like Duke University, Harvard University, University of Pennsylvania, and they provide very valuable lectures to our students. Teaching labs. Within the department, there are a number of teaching labs that relates to medical physics. So these are some examples. And among those, you can see I just want to highlight one thing that is most directly relates to medical physics. That is the radiotherapy planning and the treatment simulation laboratory. Like here we have about 20 radiotherapy treatment planning workstations. So these are just a few examples. These are exactly the same workstations that the hospitals are using for patient treatment planning, okay, for cancer treatment. And lower left corner here, that is a virtual reality-based radiation therapy treatment machine. So it's an excellent teaching facility, okay? And on the right, left-right corner, that is a MRI scanner, 3.T Siemens whole-body MRI scanner. That is actually currently under installation, so it will be ready for use very soon. These are also resources for teaching as well. So career paths, okay, and these are the main, I would say, possible paths for students graduating from this program. I mean, in the long term. So first of all, of course, hospitals, right? People can work in different departments like radiotherapy department, radiology department, clinical engineering, in different roles. Okay. Also, industry, especially health industry, is booming. I don't know if you realize, but healthcare industry will be a major driven force, for many years from now on. So I think there will be many opportunities down the road in this area. So within the industry, you can either do healthcare related research and development works, marketing, some other things. Of course, academia is also a very interesting and attractive option for students. Okay, and you will, of course, need to pursue a PhD degree further, and also possibly a postdoc afterwards, and then you can become a professor or scientific officer working in the academia. That's also very possible. And there are some other opportunities like government regulatory officer. There are government offices for regulating the uses of nuclear related issues and the use of equipment, provide oversight. Okay. And also entrepreneurship, that's also a very interesting development, okay? Because we are dealing with many different type of healthcare equipment and new developments, new techniques, and actually many people are quite interested in that development, that area. So opportunities within the program, okay. So first of all, there are different types of scholarships or fellowships that are potentially available. And especially for this year, okay, this coming year for the 2021 intake, we recently secured a government fellowship. For this program, we have 3 quota for government fellowship. Okay, and there are some details here I don't have time to go through, but basically the government will provide you a great amount of fellowship, not 100% coverage, but I think it's roughly about 60%, 70% coverage of your tuition for this program. Okay, so specifically for medical physics, as I said earlier, we have secured a quota of 3. Okay, and within the program, the department also provides merit-based scholarships that's based on your academic performance. Okay, and also students enrolled in this program will also have opportunities for some research, and you know, it's possible that some students can receive, you know, research assistantships as a part-time, you know, research assistant or something like that. Okay, so we do have students currently, you know, under that kind of support. So networking, as you can see earlier, we have a large number of you know, local professionals involved in teaching, including overseas scholars as well. So you will have the opportunity to network with these people and learn about the fields. And more importantly, you know, if you choose to become a physicist, and these are the people potentially you'll be working in, so it's good to know them, you know, during your study. And also, you know, potential opportunities for local and non-local placement or exchange. And if you are interested in research and want to pursue a you know, research-related career after the study, and there are many opportunities within the program that can be provided to you. Currently, you know, the program have, you know, more than 20 active research grants, okay, supported by the government, industry, and with a large amount of funding available. Okay, so I think very likely that you can be involved in many of these research projects. And also, you know, relates to about networking opportunities. You may have the opportunity to collaborate with some international scholars. Okay. So finally, I think this one will be interesting to you. These are some numbers from this year's enrollment. Okay, as I mentioned to you earlier, this year, the academic year of 2020, 2021, that's the first year of medical physics program, and we had 71 applicants. I think that's the correct number, if not more. Okay, and we admitted 26 students, okay, from these applicants. This is actually a little bit more than the quota that we had. We had actually 20 quota, but we have some really good students, so we overshoot a little bit, okay. And on average, these people have about 20 months, okay, 20 months of mean working experiences. But I just want to let you know, we do have a number of students, they are fresh graduates, okay? But we also have students with quite extensive working experience. The mean GPA at 3.27, and many of our students are really good. Some students actually have GPA over 3.8, you know, excellent students. A number of them have first-class honors. Another quality of the students, as you can see here, you know, 90% of the students are from, you know, QA's top 100 universities. And also, you know, 65% versus 35% as the male-female ratio. The reason I list here because, you know, medical physics, it may sound like, you know, it's, you know, you may think that we would, you know, would prefer male students, but reality, I think the ratio is very reasonable, okay, just for information. Last one is also very important, okay, medical physics, you know, based on its definition, right, it's the application of physics in medicine. So we do have a large number of students with physics or engineering background. As you can see here, 30% physics or physics-related backgrounds, about 40% engineering, different kinds of engineering, you know, biomedical engineering, electrical engineering, 40%. And the other 30% are from like health technology or other related backgrounds. So this is the overall ratio. Okay. Okay, that seems the end of my talk today. I hopefully provide you some general information of the program, and welcome you to apply for our program. If you have any further questions, you can either contact our secretary, Ms. Candy Yuan, for any process information, or you can contact me directly for any academic information. Okay, and also for today, please feel free to leave your questions here, and I will address your questions during these Q&A session. Okay.